we're really happy to have you here today. I have grown to really enjoy these presentations, especially when I'm not doing them. So Vilija, thank you so much for joining us. I'm going to tell them quickly about you. So Vilija is a licensed clinical psychologist. She's a certified dementia practitioner, which I think that's kind of rare. I don't know of another dementia practitioner. Perhaps there's others on here, but that's a really good resource to know. Vilija works with kids, adolescents, adults, families, couples with lots of diverse backgrounds. She's worked in outpatient and residential, group practice, community. You've kind of done the whole thing. Therapeutic schools, youth centers, and in parish settings. I think you just haven't worked in an interplanetary way, but other than that, I think you've got most other things covered. That's fantastic. That's great experience. She's taught, kind of an Adlerian at heart, it sounds like. And you work a lot with folks who struggle with anxiety, trauma, insomnia, relationships, life transitions, and other concerns. So Vilija joined Crosswinds Center for Personal and Professional Development and is serving clients in Wheeling and in surrounding areas. So a very well-rounded background. We're thrilled to have you here. You know, I can tell you, I feel like I'm talking to people in my life, clients, friends, family, about insomnia right now on a pretty regular basis. So when you propose doing this, and you've spoken for us before, and it was great, and we got great feedback. This is fantastic. We have lots of folks who are in need. And so I'm thrilled to have you here today. So thank you so much, Dr. Ball, for doing this with us. And we'll listen to your presentation.
And thank you so much, Dr. Jacot, for this gracious introduction. It's an honor and privilege to be here, and thank you for having me again. And yes, my expertise in this area comes from CBT-I for insomnia, and this morning I don't have anything to disclose. And also I am a member of American Association of Sleep Medicine, so that's where I am gaining my knowledge and where my passion for insomnia is coming. And especially, like Dr. Jacot is saying, insomnia today during this difficult time is our shield against the virus. And I hope my passion for insomnia is going to inspire you, and that's what I'm going to try to do, trying to show research studies on how important sleep is, and then obviously we'll go and stay a little bit in the CBT-I domain, and we'll try to introduce a case and application of CBT-I, and obviously get all of your feedback and insights and questions. So unprecedented disruptions, what happens? They turn our lives upside down, right? And life is transitions, about transitions, how much through lifespan we go through transitions, and we need adaptation. And as human beings, we have enormous capacity to adapt. And here we are in COVID-19, a pandemic that's obviously unwelcome, unexpected, disruptive. And how do we adjust to it? And obviously with all the losses and all these unprecedented things like home confinement and isolation and the effects on our mental health and well-being and quality of sleep. And the research studies are showing how these confinements and isolations tend to increase our anxiety, depression, and PTSD symptoms. And these unprecedented changes, unprecedented disruptions need unprecedented changes and flexibility. And what happens to various life domains, depending what your personal circumstances are in terms of work, school, many changes need to be made. And all these three big pieces that usually are involved in disrupting our mental health and sleep are uncertainty, insecurity, uncontrollability. And we are dealing with all of them in this environment, all kinds of environmental stressors, multiple worries, and a question, what is still within our control? Maybe that question is on your mind. And hypothetically, I want to ask you, maybe and maybe sleep is the only thing that you might control and you might need to control, and that is going to help you to adapt to the situation. Why do we sleep? Is your morning wiser than you felt last night, last evening? Did anyone in your life ever said sleep on this problem, or go to bed and you will get a better answer tomorrow morning? And maybe you were able to experience that. And I am wondering if there is actually scientific evidence to that. Grandmas or moms or a wiser persons in your life question about advising to sleep on the problem. After we will go through some research studies, I hope we will find that support, and how sleep is, looking at that pyramid on your screen, how sleep is among our basic needs. We cannot enjoy life meaningful experiences unless we have restorative, good quality sleep. And as researchers are showing to us, sleep supports our fundamental need and many functions in the brain and body. And it can be, and it is, as water or food, quality of sleep and sleep at the right time. It's also quality of our emotions functioning next day. Research shows that it's directly related to the quality of sleep or disruption of sleep, and managing sleep problems right now, when we have to deal with so many stressors in our environments, can be preventative and can empower us to do a better job. Just some awareness and reminders of what we know about sleep and its role in our lives, how it is involved in memory processing, information of memories, consolidation and assimilation of knowledge and schemas, and generalized knowledge and learning process. Many times we think that we are wasting time at sleep, right? And what's happening during sleep, we are learning, our emotions are being processed. And how much is now sleep might be strengthening our immune system when we do not have a vaccine yet against this virus. Sleep is boosting our immune system. Antibodies can be developed, blood sugar metabolism balance out, physical recovery, that growth hormone is being released, and brain detox is happening. All those waste proteins, harmful proteins are being washed by cerebral fluids from our brain, and such thing as beta amyloid that is implicated in Alzheimer's disease can be alleviated from our brain. So sleep deprivation, just looking at this chart that I will leave you to ponder and later examine in more detail, how much can be disrupted in our bodies, from memory to cognitive abilities, and how weight can be impacted and diabetes can develop if our sleep is disturbed and we are sleep deprived. Briefly going through sleep anatomy and reminding what are the brain parts responsible in our production of sleep. Hypothalamus, right? Our thermostat is affecting sleep and arousal, trying to balance that. And suprachiasmatic nucleus is processing light from our retina and controlling our behavioral rhythms. Brainstem controls transition between wake and sleep, and it also plays that role during our REM sleep, keeping us restrained to bed, that we wouldn't be acting out our dreams. And sleep promoting cells in hippocampus and hypothalamus and brainstem release GABA and reduces activity arousal. And we probably experience, when we run low on GABA, what's happening with us, right? How we aroused are, how anxious we are. And thalamus seems to be relatively quiet, although it transmits information from cerebral cortex, but it is involved in all producing all that fun activity of dream, all the images and sensations and dreams in REM sleep. And talking about the sleep COVID-19 sleeps and those vivid sleeps, what thalamus is doing in our sleeps these days. We will talk a little bit in our dreams these days. We will talk a little bit when we talk about sleep stages, but research studies are showing that sleeps are, during sleep, many people are having very vivid dreams, and they are somewhat reflective of even post-traumatic stress disorder, more quality of nightmare. Pineal gland receives signals from suprachiasmatic nucleus and helps us to produce melatonin to ensure better sleep. Basal forebrain is promoting sleep and wakefulness, releases adenosine. And if you are looking on the right side and thinking about a cup of coffee that you had this morning, you are seeing how adenosine, caffeine is trying to trick adenosine and bind with adenosine receptors, and how within 2 hours you are getting more benefit from caffeine, and adenosine cannot impact you that much during that time. Midbrain acts as arousal system, and amygdala is also, our emotional brain is involved in REM sleep, and no surprise there. Talking about what's happening during our sleep in terms of sleep stages and various brain waves involved, we are going through rapid eye movement and non-rapid eye movement stages, and quality of sleep involved in those stages. And non-REM also has 3 different stages, and every one of those stages are connected to various brain waves and what's happening in our brain. And quality and intensity and is reflective on the screen from wakefulness to deep sleep. So when we start with non-rapid eye movement and REM, the first stage, we kind of transition from alpha waves, drowsy, relaxed, to theta waves, and our body is slowing down. All vital functions, heartbeat, breathing, eye movements, relaxing. And we do not spend that much time in this stage, from 5 to 10 minutes. If someone would wake us up, we would probably even be saying that, no, I wasn't asleep. And we also then transition to N2, that is all the slowing down is continuing. And what is significant to this stage, sleep spindles and K complexes. And we see N2 where this sleep spindles are more dense waves, and then these bursts of electrical activity that are characteristic of this stage. And N2 is almost like our launching pad. Through the night, we go through various stages, but many times we return to the stage and launch from it again. So we spend about 50% of time in this stage. N3 is significantly different in terms of delta waves. If you see how the amplitude and how different they are from all those representation of other waves, no wonder that it's characterized as slow wave deep sleep. And this is most refreshing and regenerative type of sleep, where growth hormone is released and immune system is being strengthened. And so many great things are occurring that probably we want to spend more time in this stage, right? To get that quality refreshed sleep in the morning. And the less time we spend sleeping, the less time we spend in this stage, right? Because we transition 4 to 5 times through all these stages. And if someone is sleeping a few hours, obviously they might just go once through the stage. And I don't know why it's a kind of like pride, some kind of badge that people have, bragging about, oh, I slept just so little, but I have done so much. And looking how much we benefit from sleep and how much we learning and what's happening to our bodies, how we are regenerated. I hope a reminder about this and more awareness thinking, especially at this time in the stressful context of a pandemic outbreak, we will try to be protective of our sleep. And obviously REM sleep that occurs about 90 minutes into the cycle, and where our bodies and all the vital functions go back to almost kind of wakefulness functioning, and breathing increases, heart rate. It's kind of spooky, right? The eyes are rapidly moving, but the brain stem is keeping us restrained and not allowing to act on those dreams. So this is good to keep in mind, because as we go further and see in research studies what's happening during that REM sleep, it's not that just fun or bizarreness of the dreams, but something significant is happening during this time. And I just have a little diagram for you to follow how wakefulness signal branches out from upper pons and moves to thalamus and then cerebral cortex, that consciousness, the site of consciousness area where you can go and learn more in depth about all the processes occurring during our sleep cycles. So yes, research studies. What do we know about learning? 40% reduction in the ability to form new memories with sleep deprivation. That's significant. Looks like our hippocampus is crabby, doesn't want to register new experiences if we don't allow it to rest and benefit from sleep. Negative memories also seem to be more resistant to prior sleep loss, and that's very significant to understand that if we have more sleep deprivation, that means that more negative memories will be registered and dominating our experiences versus positive memories. So what is the implication to mood disorders? And more studies actually are investigating how maybe sleep loss and clinical mood disorders are causally related, because many mood disorders have this significant element of sleep abnormalities. And this knowledge is significant in treating clients and for our personal knowledge. Looking at the research studies in terms of REM and non-REM, looks like solution performance and test of cognitive flexibility was more than 30% better following waking from REM sleep. Significant findings. These are just few research findings that I will be introducing for you to get more excited and delve deeper to understand what's happening, how important REM sleep is, how much creativity, flexibility, and enhancement in performance is happening there. We are being benefiting from that particular stage, and how also important it is to know when to wake up, right? From REM sleep, if you need to take an exam or need to perform. So it is hypothesized that the brain state during the REM sleep is particularly amenable to emotional memory, its consolidation and improvement. And some researchers found out that also dreams and their contents of dreams play an important role in recovering from emotional trauma. So all that content and seemingly bizarre content during the dream seems to have some significance, where our brain is trying to disconnect that emotional piece, that emotionally charged, tagged thing from the content of the images and the learned experiences. And looks like this is really interesting finding to little sleep and insomnia has propensity to bias us toward negative memories, but also pathological sleep and too much sleep that commonly occurs in depression, has the same type of outcome, disproportionately amplify the strength of negative memories. What does that mean? That probably means that we need to look for ways to achieve healthy sleep, what's based on our chronotype and on best window of for best sleep that would match your biological clock and your environmental social clock. So in terms of happiness, what is defining your happiness during this COVID-19 outbreak? Happiness consists of getting enough sleep, just that, nothing more. Who agrees with me on that? It looks at least that lion is not roaring and is happy when it's sleeping. So maybe there's some truth in that. Finally, rushing through this because I am trying to get to our CBT-I and apply that knowledge for treatment of insomnia. So finally, I'm glad to come to COVID-19 studies and sleep. And what in terms of COVID-19, as you would predict, we do not have enormous amounts of studies so far, but the studies that we have are focused on changes in environment, light exposure, diet, and environmental temperature. And most of them came were done on physician, medical staff, and people in quarantine. So home confinement seems to be very significant in these studies, how it's affecting our stress levels, daytime and nighttime stress, anxiety, depression levels, and sleep disruption opportunities are plentiful. And how do we look at ways to reduce them and minimize? And focusing on increasing the quality of sleep can boost our ability and health and equip us to deal with these environmental stressors, and our internal level of stress can be reduced. What is known about stress and sleep link and confinement? Obviously, work time pressure, right? What it is like when maybe someone's kitchen or bedroom became an office, a school, homeschool, a playground, everything bursted into the home, and childcare and needing to do the work if parents are working and still need to attend to their work via Zoom, and Zoom fatigue and childcare, and maybe attending to children's school via Zoom as well. Various kind of responsibilities affect how many hours a day working parents can spend on sleep, and their ability then to handle what's happening during the day, and how that cycle, sleep can impair that cycle or can actually boost and give more energy and more clarity and mental abilities to handle that. Another significant thing is how disruption in home routines is now signaling us that where is our place of safety? Where is our place of relaxation? Most people, or many people, were able to go home after work and relax there, and that was associated with a safe place in some way. And here, it's that place, it became chaotic in many ways, and plus additional associated stressors with fewer opportunities to reduce stress, and lack of social interactions that also has a cushion and positive effects, and protective preventative effects might be lacking, and other opportunities, healthy opportunities that would reduce these risks. So many of these things, obviously, and stressors and our environments depend on our personal circumstances, right? Someone who was content and more less socially oriented or outgoing, or more enjoyed time alone, might not be experiencing stressors as inability to engage in rewarding activities. People and families that were extensively involved in socializing, visiting friends, going to various cultural outings, sport events, restaurants. That might be really difficult. What a change, what a transition, and how much even a change for children, the sports events, all the activities that they were taken to, and suddenly they are at home, how to contain their energy, what to do with that, and how that affects the level of parent stress. And then when parents are stressed, that affects children's level of stress as well. So many blurred boundaries, and how to deal with that, how to manage that. And spending more time with family can be a positive and negative depending if there is any pre-existing family difficulties, what it is like to be with a family in the same house, if there is abuse involved or huge conflict is going on. That can only add to all the other additional stressors. And factors as daylight exposure, right? Some people might be experiencing less light because if they live in a smaller space, as an apartment, windows or no windows, with small windows. But many people, even before, someone who worked in a cubicle, right? They didn't have enough light, and we know how important light is for our circadian rhythms and good sleep and alertness, how that recharges us and retunes our biological clock. Less exercise, not being able to go to gym, and all kinds of restrictions there, and maybe not enough space at home to do that. Eating more and closer to bedtime for coping purposes, that is a huge disruptor to sleep as well. So combinations of these factors may lead to sleep difficulties, additional deep sleep, sleep difficulties than someone probably had even before. And how I'm going to be able to manage everything might be one of those questions on our minds, our clients' minds. But I also want to encourage you to ask and pay attention to your clients. Is this question asked equally with the same intensity by men and women at this time, depending on what kind of household or relationship they live and what is valued and what are roles and responsibilities in those households? How to take advantage of your current situation? You might be saying, what a strange question. And why you're also on every slide saying things about light and exercise and meals. And yes, one of the things that I would like to encourage you, at least I hope can be available to everyone, seek light, right? On the days that are bright, seek light. On the days that are cloudy, try to light your room, your house, because that is so important to realign, to charge your circadian rhythms and your natural biological clock with light. And we will talk a little bit more about that. But based on personal circumstances, yes, try as much as possible to expose yourself to daylight and align your daily schedule with natural circadian rhythms and natural sleep timing. So one of those advantages, because our social clock so much regulates our day and schedule, our school time, our work time, our children's school time, and all kinds of responsibilities timing, where we might not be able to get enough sleep because if our chronotype is late, if we are late night owls, and we have to get up early in the morning, well, obviously there is a conflict there. And try to also to establish regular and healthy rhythms, daily routines and social rhythms, because research studies are showing how that those time cues are so important to regulate our biological clock. And take as much as possible advantage from positive interactions. If family interactions are not positive, seek those interactions. I'm finding from my clients and many people that everyone is so open now to interact. This common experience of stress and this context where people feel some level of connectivity, they're welcome to reconnecting with people that they didn't see for years, and even during through the social media, that is better than no interactions. And try to establish new routines, new the family, the friends, the significant others, during the time that you save maybe for no commute, no shopping time that you used to spend. What new routines can be healthy and facilitative of healthy sleep at night? So talking about the light and exercise and all our routines of eating, it's important also to mention circadian rhythms, because circadian rhythms and sleep-wake homeostasis go hand in hand and regulate that awake sleep cycle. And our daily fluctuations in wakefulness to body temperature, metabolism, as well as release of hormones. So it's governed by daylight. And so that's why I'm kind of obsessed by light and encouraging everyone to benefit from light, and affected by other factors such as meal times and exercise. These are very important. So try to incorporate that as much as possible in your daily routines, and be more aware, because sleep-wake homeostasis monitors our body's need to sleep and its timing. And also that helps us to strengthen our sleep drive and control its intensity. So sleep drive is key to sleeping well. So the moment we wake up and get out of bed, our sleep drive is at zero. It's used, it's deflated. And the more we are active during the day, the more it's being pumped. It's like a flat tire, right? When it's flat, right? We need to pump it in. So through the day, the more active we are, the more exercise, the more sleep drive is becoming stronger. And napping, inactivity, it deflates it. And the stronger sleep drive is, the more possibility you have that your sleep is going to be initiated without any kind of your trying to sleep. Trying to sleep actually interferes with the body's effort to initiate sleep. And stress, sleep environment, noises, electronic devices, blue light that comes from them, food, drink, medication, medical conditions might also influence sleep-wake, healthy sleep-wake and its balance. Light exposure also affects melatonin release, and it's very important for you to early in the morning or first thing in the morning to expose yourself to daylight, because what's happening during the day, and that daylight actually helps you to then benefit from more melatonin during the night. So it's day and night activities are very interconnected, interrelated. And physical activity, it's really interesting that both low level of activity due to confinement and high level of activity due to stress are affecting our sleep negatively. And it's also worthy to mention our chronotype, right? This morning when Dr. Jacot couldn't start the presentation, and she was saying, oh, where is everyone? We can't connect with everyone. I was thinking, oh, maybe everyone who signed for this presentation are night owls and trying to catch up with their sleep. That's why no one is signing in. So depending what is your chronotype, right? Naturally prefer time for sleep and activity. It also, that information also helps you to organize your day and to adjust and to increase more ability and opportunities for sleep. How do you naturally, what is your sleep-wake cycle? If at this time you do not have enforced social clock by work or school, this is a good time to discover, are you a person who likes staying awake later and are more productive at night, but you need to sleep longer? And obviously, if you would need to wake up at 6 in the morning or 5 in the morning, you wouldn't be able during normal time to benefit and get natural sleep and enough sleep. So this is the time for you to discover, are you that night owl or morning bird? And try to synchronize your schedule and try to fight against that social jet lag, that is discrepancy between your social and biological time and social clock imposed by school, work, or other responsibilities that you might have. And also recognizing maybe you are permanently exhausted pigeon and what that means, like what is causing that. And maybe other sleep disorders are involved, maybe not just lack of sleep because of chronic insomnia or stress or anxiety. Maybe other sleep disorders need to be ruled out and treated. So this Munich chronotype questionnaire has been used for 15 years, and it measures circadian features and correlates with several aspects of human and health performance. It's very interesting that even some medical research and some physicians starting to use our chronotypes, when to administer the treatment and when to administer medication, because someone's social clock or sun clock might be running different, not consistent with their biological clock, right? Someone's biological clock might be 6 a.m., but they are prescribed medication that is supposed to be taken at 9 o'clock based on understanding that this person maybe woke up at 8 o'clock, and how that inconsistency and how that might not be beneficial for that person, or might induce some side effects. So individual chronotypes can optimize our performance, our cognitive and physical performance, and growing body of research in these areas. Also, it looks like individual chronotype can improve sleep longevity if early chronotype is matched to early schedule for people who are working as based on various variations of schedules. So obviously I try to encourage everyone to take benefits from at this time, how to cushion ourselves against stress and increase quality of sleep and be protective of sleep, but this may not be enough to reduce all the negative effects, excessive levels of stress. And this time can also serve as a way for us to increase our awareness of sleep and use it for education of many people. And some people who are advocates, such as Dr. Spadola, for sleep health and quality in various environments, are wondering, maybe we need to be more aware and to teach ourselves and students and as clinicians to have this information and knowledge to be transferred to our clients, that they would be able to benefit from it, and it would serve as a preventative factor. And I'm very excited to then talk about CBT-I, that is actually first-line treatment of chronic insomnia. And many of these components can be used also by people when they just run into a little glitch during the night. It's beginning, even falling asleep, right? Because insomnia is kind of like a subjective disorder where people subjectively feel like they cannot fall asleep, or their sleep quality is not is not where they want to be, either initiating sleep that people are struggling, or sleeping through the night, or sleeping too little, and early morning awakenings, and that starts interfering with their life and work and relationship. So key elements of CBT-I, I will try to simplify it and make it as concise as possible, are stimulus control, relaxation interventions, cognitive reappraisal, paradoxical intention, sleep restriction, and sleep hygiene. So stimulus control is simply our ability to have healthy understanding of our bed and bedroom. So problems start happening when in our mind, our mind is confused what's happening in our bedroom and bed. If bedroom and bed are linked in our mind to wakefulness, then obviously we will go to bed and bedroom, and our mind will be wondering what I'm going to do here at this time. So sleep quality depends on this quite a bit. We need to get our stimuli out of the bedroom, and only sleep and sexual activities are allowed in bed and bedroom by CBT-I. Relaxation interventions. How our context of COVID-19 is so emotionally charged, and so many people are anxious and about uncontrollability, and not knowing what's going to happen, and uncertainty. So lots of cortisol being produced at this time by all these things, and how to find a good match of relaxation interventions for people that they would reduce stress, reduce arousal, right? Because if we go to bed and we are aroused, our minds are aroused, obviously no good quality of sleep is going to be able to take place, and it's going to be very difficult to initiate sleep. What is sleep restriction? Well, it actually refers to our ability to sleep in bed should equal our longevity, and time in bed is equal, it should be equal. So for example, if we sleep 5 hours, so we should not spend more time in bed than 5 hours. If we woke up, we should actually leave bed and go and engage in other activities, not to try to work on initiating more sleep, or spending time there doing something else, or just resting. If someone wants to rest, they should remove themselves from bed and rest somewhere else, again, because that would interfere with stimulus control, and time in bed should equal time of sleep in bed. I hope I made it clear, over-explained maybe a little bit. Cognitive reappraisal, how many things are happening in our minds right now, right? When we go to bed, and how many worries and concerns and anxiety-informed thoughts and beliefs are circling in our minds. So someone might be awfulizing and saying, oh my goodness, I'm never going to fall asleep, and that thought might be overwhelming them. Or someone might be worrying that what's going to happen with their loved ones, how this virus is going to affect them. Maybe someone lost someone, or afraid for their health or their children, and how to actually change that self-talk, how to look at those beliefs and reappraise, and to help to find some resources to quiet ourselves, and to also before bed sit and or during the day sit and come up with some kind of problem solving or plan making. Those types of things reduce these types of thoughts. Some of my clients, they find when we work on this piece, they find really interesting ways to change their self-talk, and talking about not credible information, right? Like, let's say the voice in your head is talking how everything is going to be doom and gloom, and pulling the history out and looking at your ability to overcome various kinds of challenging, reminding those facts and looking at those thoughts that try to intimidate, and talk to them and push them back and declare them not credible. That can be helpful. Some people are so creative in this this intervention, how they adapt that personally to them. Paradoxical interventions. Many people have this urge, propensity, this desire to work hard on producing sleep. Like they are saying, I'm trying hard to sleep. And that's really interesting that this actually is not working. This is just interfering with our body's ability, our sleep drive to take over and produce that sleep. So assigning someone actually to try not to sleep can be the best intervention ever that can actually initiate sleep. And with the sleep hygiene, right? Many people actually treat themselves with sleep hygiene from insomnia. And that is actually a little bit too late. Actually, it's almost resembles if someone would be treating a tooth cavity with tooth hygiene, right? Tooth cleaning. So the same treating insomnia with sleep hygiene, that's the same type of thing. We should already use other interventions that CBT-I produces, but sleep hygiene is a good adjunct with CBT-I, although by clinical trials it's been used as control intervention, and seems like other CBT-I and even pharmacotherapy work better than sleep hygiene when an actual problem exists. But sleep hygiene, you can introduce it and set it, practice it daily to prevent insomnia. So all those no's go with sleep hygiene, and obviously there are not everything just no, but no caffeine drinks and reducing alcohol intake. It's no exercise immediately before bed, but actually light exercise, some stretches, yoga before bed can help you to relax, can help us to relax. No clock watching during the night, that it causes arousal, ensuring optimal room temperature, having a comfortable place to sleep and mattress, and maybe light blocking curtains, and obviously no bright light, because that's going to disrupt sleep. That's what happens in the morning. We need bright light in the morning, and that blue light in the morning to awake us, and at night we don't want to disrupt melatonin production. So all these are pretty much things associated with CBT-I. And I also, before we go to questions, I also would like to encourage everyone your access to maybe underserved individuals and communities, and promote this information, because how much this information can improve health outcomes among underserved and vulnerable populations. Dr. Spadola and Groton, they have been huge advocates, and I think Dr. Spadola, if I'm not mistaken, created a program for underserved populations, even in sleep shelters, I believe, were improved so much the sleep environment and quality of sleep for the populations like that improved their other mental health conditions. And talking about effectiveness about CBT-I versus pharmacological interventions, I would like just to stress that hypnotic medication in the treatment of chronic insomnia, lack of evidence for long-term efficacy, and also have side effects, and then people struggle with weaning themselves off. But for short-term pharmacotherapy may be effective, especially at this time where people are struggling and might be in such state that they are so sleep deprived that CBT-I, they do not even can't embrace or understand that concept, how much they need some other type of intervention. So short-term psychopharmacotherapy can be a good thing, but CBT-I is being recommended by most authorities as first choice treatment for insomnia. And before we go and try to look how that works hands-on in this case, I would like to take a break and to see what kind of maybe questions are coming, and something that we need to address with our participants.
Great, thank you. This is wonderful so far. Thank you so much, Vilija. So I'll go through the questions. If someone has a question, now is your chance. If you can please write it in the Q&A. I see there's a hand raised, but if you wouldn't mind just writing your question in the Q&A, we'll try to tackle a few of them right now for a few minutes. Okay, so this is from Megan Mann, who's one of our wonderful therapists at Juniper. She is level 3 Gottman trained. We're so thrilled to have her. She's a newer addition to our practice. Just so delighted to have her. So Megan asks, at what stage of sleep waves can one achieve with medication? At sleep/waves, can one achieve with medication?
That question I probably would refer to the prescribing physician, and I can maybe bring some research and later refer Megan to the research, but I would be answering that outside my practice, my area boundaries. So that's really good question. That's a very interesting question, and that prescribing physicians obviously should be in tune with that. That probably we should encourage prescribing physicians to be more in tune about research with chronotypes and what research is there on the sleep stages. Wonderful question.
That's great. Okay. From Ruth Lipschitz. Hi, Ruth. How are you? Already there is research showing women are still doing way more home and child care, even with men at home and both working. Yes, I think that was your commentary about, you know, some of the stressors that people are under at the moment. This is also for Megan, and I love this question. My children wear blue light eyeglasses while viewing their computers throughout the day. Does this help with sleep?
Blue eyeglasses.
Blue light eyeglasses, they're, you know, they used to, I remember, I don't know when, they were the blue blocker glasses. So it's I think a blue blocking.
Yeah. So if the glasses are actually blocking light, and how that's a wonderful question in terms of the sleep hygiene. If the sleep environment has some kind of light coming from somewhere, sometimes people even keep lights to be able to move at night, to go to the bathroom or whatever. And for more older people that they would see a path. So if there is the house is lighted and the light might be interfering with producing sleep and with production of melatonin. So whatever reduces that light obviously would be very helpful. So those glasses, if they are helpful to reduce and to block the light, obviously would be a good device to use, but I don't know if that would be comfortable. That can be probably achieved by just simple kind of eye covering that blocks the light. That some people use that, but if those glasses are comfortable to sleep with, I would say, why not?
I think they're using them during the day while I've heard this, that some folks are having their kids or for themselves as they're on a screen all day. There's a particular kind of lens that's a blue blocking lens. And so they're using those while they're on the computer. So, yeah.
So the night, if obviously if that helps to block the blue light, and teenagers are using that before sleep, that sleep hygiene is saying no technology, no blue light before sleep. Yeah, I can see what you are saying. That would be great, probably. I don't know any research behind that, and that would be interesting to look. But if actually it comes from anecdotal evidence and it's being seen that it's helpful, obviously, probably using that if it helps personally.
Yeah, sounds like a good plan. So I mangled Megan's question when she was asking about, I thought medication, speaking of glasses, my brother, the optometrist, I'll have to give him a call. She was asking about meditation, not medication. So, sorry.
Meditation, I'm sorry, go ahead.
So Megan, if you wouldn't mind retyping your question, we'll get back to it, but I fumbled that one. Okay, so she's also asking, are there longevity studies on people working the night shift?
Longevity studies in terms of, is that if it refers to the chronotype, when I mentioned that, yes, that based on particular studies where if people are matched more to their chronotype and their social clock, whichever that shift is, for example, early morning birds, if they are matched with early shift, that increases their sleep longevity. So in terms of that, I know that there are research studies, yeah.
Wonderful. Okay, this is from Margaret Pachoda. I don't know if it's Margie or Margie. I have a friend Margie, but I think it's Margie. So hello to you. Glad you were able to get in this morning. Margaret says, I read somewhere that removing the blue light has limited efficacy. A few hours a day is fine, but more than several hours a day, even with the glasses, is problematic. Thank you.
Good comment. Okay. Yeah, appreciate that.
What are your thoughts about playing meditation music or yoga nidra guided meditation to help people get to sleep who have had issues with insomnia?
I think that's wonderful. That's that component of sleep hygiene, right? And obviously sleep hygiene, we should work with people to establish what is a good match with whatever preferences that they have. I have some clients that I have a hard time selling meditation, and I just start talking about meditation, they start rolling their eyes. So, but I think that some people meditation would be wonderful, and that's calming and can get them to relax and reduce that arousal. And we are trying to achieve to reduce the arousal. I think what is like a disclaimer there, teaching the clients to understand that this meditation or whatever they are using to relax more should not be in their mind associated, classically conditioned, so to speak, with, okay, this is going to be my tool, this is going to make me fall asleep. When we make that type of association, that is almost the same like trying to sleep. That becomes our crutch, and that takes over our body's natural ability, over that body's drive to initiate sleep. So that should be with whatever sleep hygiene we are encouraging people to use, and we work with them to come up with a plan what they're going to use. That always should be, okay, I'm going to use that to be healthier, happier, more relaxed, but not, this is going to be something that will make me fall asleep. If that association is made, then we will need to work on helping them to make a distinction between that, because that might interfere with their ability to sleep. But otherwise, yes, meditation is a wonderful thing for many people to incorporate and help them to prepare themselves and reduce arousal to have a healthier sleep.
Okay, wonderful. So we have time for maybe one or two more right now, and then we'll circle back to these in a few minutes if we have extra time. These are great questions. This is from Marcia Gibson. Does wearing eye covering help with sleep?
Yeah, that might help. That's part of the hygiene, sleep hygiene. And if eye covering actually reduces the light that is in the room, in the bedroom, obviously that will contribute to all the other things that I covered in CBT-I. So if there is a need to cover the maybe curtains or blinds, actually do not block light enough and there's light on the street or whatever that is. So obviously that would be a good way to practice to reduce light and increase melatonin production.
Great. Okay. So I think that is our time for the moment. We're at 10:35, so we will circle back to these. We do have a couple of quick clarifications. Margaret said the glasses are helpful, but screen usage should still be limited, so it's not a reason for somebody to say, oh, I have blue blockers. I can now, use screens until 2 seconds before I'm going to bed. So thank you.
Yeah. The creativity of our teenagers, right? Saying like, oh yeah, these blue glasses actually make things wonderful. Yeah.
So, okay, wonderful. So we'll circle back to these. I understand that you also have a case, Vilija, that you wanted to.
Oh yeah, I almost forgot about the case. Got so excited about all the questions. Yeah.
So if I can say one more housekeeping piece. So why don't we do the case? Then if we have a few minutes to do some questions at the end, fantastic. I'm going to be signing off about 5 minutes early. Aline is going to finish us up for the day in terms of housekeeping. I have to get to a family session for a relative, so I'm going to be heading out. But thank you if I don't get to say that. Thank you for joining us again. Thank you, Vilija. Why don't we go ahead, let's do the case and we'll see.
Yeah, so this is the case, and probably people got tired of listening to me. I just want to give like 1 minute for everyone to read the case, and we can talk a little bit more about the case. And then if we do not get to the subsequent slides, you will get the presentation, and subsequent slides have more recommendations for sleep for various populations. And hopefully that will also answer some of your questions. Go ahead and read the case. Well, I hope everyone were able to read the case, and I will just start sharing some of my hypotheses and how CBT-I would be implemented in this case. Not obviously, not talking, excuse me, not talking and looking at probably what's happening that this person might be happening with other disorders, not going into that type of diagnosis. Obviously, we would need to rule out and identify maybe something else is going on there, medical conditions or substances of any kind. But I will just stick to this particular vignette, and we'll be looking and seeing what's happening in terms of what vignette is giving to us. And maybe you recognize Jen among some of your clients and thinking like, oh, okay, I know what's happening here. So in terms of stimulus control, it looks to me that we would need to probably do some stimulus control interventions, because during the night when she worries and she can fall asleep, it looks like she is associating and conditioning bed to be a domain for worrying. Her bed is being associated with worrying, so every time she is going to come to her bed and bedroom, her mind will start engaging in that activity. So that's where stimulus control would be applied. Also, it looks to me, it might be that she's watching TV in her bed and eating her cheesecake and drinking pop. So the bed also again is being associated with wakefulness, and we would ask Jen then to remove all those things from bedroom and make those clear boundaries and help her to establish that place just for sleep and just for that purpose. We know that she lives in a small apartment, and maybe that is a studio, whatever it is. And if she's doing everything from her bedroom, if someone lives in that type of small space, we would invite that person to think, okay, so what covers on that bed will be for day and what pillows will be for day. And then for night, covers and pillows would be changed, or office work or whatever other activities would be done, maybe not out of bed, but from other type of places in the bedroom, from the chair or some other comfortable seat. That bed would not be associated with all the other activities. In terms of relaxation interventions, it looks to me that Jen is very aroused. She is running, so to speak, on cortisol, and how to reduce that. Some of you now during the questions talked about this piece and actually sleep hygiene. So with Jen, looks like we would need to look into stress reduction and arousal reduction, because she is trying to reduce her arousal with cakes, right? With cheesecakes and pop and watching TV. And by doing that, also that presents sleep hygiene issue, because here she is exposed to blue light. She is also eating before bed, and that then kind of makes things difficult and engages digestive system that interferes with sleep production system in the body. So obviously a lot of sleep hygiene things have to be addressed there. Caffeinated drinks, right? Looks like she's, if I remember correctly, she's taking quite a bit caffeine that obviously interferes with production of adenosine, and lots of chaos going on there. We need some clear boundaries, some routines, some healthy energy boosters that Jen would exercise, find time to exercise during the day, maybe even engage in some kind of relaxing activity with her daughter, 30, 40, 60 minutes before bed, where they both would have that routine. And it looks to me like Jen might be that night owl chronotype, and she can look how she can now benefit best from the optimal window of opportunity to sleep, what is biologically preset for her. But the fact that she is so aroused and so stressed, that also might be playing into that. But just that piece where she's kind of relying on her daughter, who's probably, yes, early bird chronotype, who's early riser. She's relying on her to be awakened, but obviously she's not sleeping enough, so that might be the problem. So relaxation interventions, yes, like someone says, meditation, I would work with Jen to determine if meditation, or maybe even journaling sometime during the day or a few hours before bed, where she would be able to lay out her worries and concerns, would reduce and would be fewer of them on her mind. That might help to her. Maybe she would enjoy then reading with her daughter, or doing light yoga stretches, or just watching together an enjoyable movie that would have less arousal, or any other activities that would before bed build that buffer zone and would be protective of sleep and would be relaxing. In terms of sleep restriction, I'm wondering if we would need to implement something here, because in the vignette, I do not see anything that would be saying that she is sleeping in bed more, that she is laying in bed or spending more time in bed than she is sleeping. So if she were to wake up after those 4 or 5 hours and would still try to lay in bed, we would try to encourage her to get out of bed after those 4 or 5 hours and do not spend more time there, that she would not deflate her sleep drive. Remember that sleep drive starts kind of building itself after we get out of bed and engage in becoming more active, engage in activities. In terms of cognitive reappraisal, there is a lot is going on with Jen, where she's talking about her head is spinning and she has multiple worries on her head, on her mind. So we would need to actually psychoeducate her about how to change her self-talk, how to look at her thoughts, and how to reappraise them, how to discredit them, so to speak, if there seems like that arousal and anxiety is there. So obviously her thoughts and beliefs are actually informed by anxiety. So how to address that, and how to empower her to speak back to those thoughts and discredit them, and put her mind at ease and calm it. And also during the day, we would encourage maybe her to schedule time, so to speak, on those thoughts when she goes in bed and those thoughts start bothering her, that she would talk to those thoughts. You know what? We have a scheduled time tomorrow at 5, 6, or whichever time, and I will worry. I will look closer at what you are telling to me, but now I'm going to sleep. So if problem-solving plan, whatever these things she's worrying about, is not going to work, then Jen would need to look, because some of the problems, right, like COVID-19, obviously Jen cannot solve that problem. It's there, it's here. She needs to probably use radical acceptance that it's here, and what do I do with it? So she will need to look and identify better working coping skills that than actually cheesecake or pop or just relying on TV. So in terms of cognitive reappraisal and relaxation interventions, I think these would be key things in the interventions. And paradoxical intention, I think she was mentioning that she was trying to sleep. So obviously assigning her and instructing her, saying that she would give up on those efforts and would actually would try not to sleep, would reduce her interference of natural sleep drive, and that might help things. And in terms of sleep hygiene, obviously it would be a good intervention, and many things she would need to change, what she's doing during the day, how she can boost her energy in healthy ways and reduce her stress through exercises, and then in the morning to expose herself to light, to set her biological clock in a good rhythm, and have routine through the day, healthy routines that would be good cues to communicate with her biological clock, and start producing good quality sleep at night with better melatonin also production at night. So these are just a few things from CBT-I perspective, and I'm wondering if there are any questions that people have. And
Hi, yes, there are quite a few questions. I'm not quite sure. I'm not quite sure where Dr. Jacot had left off. I will pick up with Dr. Gail Petrich. I'm going to read. I have had many clients over the years who use Benadryl or Unisom every night to sleep. What are the long-term effects?
Well, obviously, as I mentioned in the comparison, what research studies are showing between effectiveness of CBT-I and medication, American College of Physicians are talking about medication as something more when after CBT-I is administered and it's not working, because medication do not have studies saying that they have long-term effectiveness for individuals to use for chronic insomnia. So obviously in those situations where people are prescribed medication, working with prescribing physician as a clinician, as a therapist, and working hand in hand, helping people to wean themselves from that medication, because there's addictiveness quality and then reliance on medication. At some point it stops working. So that would be something to work with a prescribing physician, what to do, and how to maybe try CBT-I and see if that would help. But many times we use CBT-I with people who are already on medication, and one of the things that we would need to do to help them to wean themselves from medication, but that is not like a prerequisite to have someone to stop right away, and that's not a good thing. We would need to work with a prescribing physician to do that.
All All right, I'm going to ask the next question. If this is already asked, please let me know and I'll go on to the next one. Jamie Peller asks, so are naps still good if you are an early bird? Is it necessary to take a nap in the bed? Can you address waking up in the middle of the night and not being able to go back to sleep right away?
Yeah, wonderful question. Appreciate that question. Naps are kind of discouraged by CBT-I because from its perspective, they deflate our sleep drive, right? So in terms of, we didn't talk much about sleep restriction here, right? So if early bird, obviously, he has to determine optimal time to go to bed. So depending what is, we would use what we call sleep schedules. I would give to clients 1-2 week sleep schedules. They would be completing them every night, and that would help me to determine what is their optimal window of sleep for their particular chronotype. And if someone is early bird, that means that this person should go earlier to bed, right? And many times that might interfere with various social engagements, activities, but kind of the naps would be interfering with healthy sleep drive and maintaining healthy and quality, then producing quality sleep. So we would work how to achieve the time during which this person can get most refreshed and most sleep, that these naps would be eliminated. In terms of the night awakenings, that's awesome question also. As we talked about sleep restriction, yes, the time in bed should be equal the time of sleep. And if someone is awakened during the night, that person should get out of bed after 15-20 minutes, because then the bed in the mind again is being paired and associated with wakefulness, with worries. So this person, usually with people like that, I'm working to establish something pleasant outside bedroom, outside bed. If it's possible outside bedroom, if someone lives in a bigger space, and just leaving bedroom, going to, so to speak, a nest, creating some kind of pleasant place, a chair, maybe even something nice in a corner somewhere if there's not enough sleep, with a blanket, with a book, with something that this person maybe don't have time during the day to enjoy, and going and enjoying that activity and going back to sleep only when this person is sleepy. That's the major rule, to go to bed also at night. People should go to bed when they are sleepy, but not when they are tired, because those two are not consistent. When someone is sleepy, that already signals that circadian kind of clock is working, melatonin is working and doing its part. But when someone is just tired, they might go to bed and then spend time only, suddenly might feel awakened in bed, and that might just work into associating bed with wakefulness. So yes, we want to avoid naps during the day. There is obviously shift workers need naps, and that's like a different type of population. That would be a different type of presentation for them. But otherwise, naps are going against our natural ability to empower sleep drive to initiate sleep. So I hope I answered the question.
Yeah, I think you did pretty good there. You guys, so we have 21 more questions. If you're able to stay on, we're going to go beyond 11 o'clock, if that's okay with everybody. I am going to start the polling. We do need anybody getting a CEU to complete that, and anybody else who would like to complete it, we would love to see your responses. So polling is now active. And the next question is from Jennifer Wolf. Some of my clients take melatonin. Does this make up for melatonin the body produces?
Jennifer, from CBT-I production, from CBT-I perspective, it's best to rely on natural melatonin. There's no, like, research studies are ambiguous about the over-counter medication, and that would also just increase our reliance. The same like what I was talking about meditation. If someone is actually relying on meditation as a crutch to make them fall asleep, that melatonin also can become a crutch and interfere with natural body's ability. In that particular case, obviously, I cannot give any kind of suggestion, and that should be worked with the person and maybe even the physician that is taking care of that person. But from CBT-I perspective, any kind of additional introduction of medication or some kind of activity where someone would be saying, this is my way to fall asleep, would be interfering with body's natural ability to fall asleep and weakening sleep drive. But there is some, I think there are some studies, although they're inconsistent, how melatonin can help, and many people are taking melatonin. And I think one of the studies that I saw, that someone has actually to take melatonin 3 hours before sleep in order to actually benefit before their preferred time of sleeping or when they become sleepy. So that's what I can just say about that. Thank you for the question.
All right, the next question is from Deborah Greenfield. Can a person be both an early bird and a late owl and still be sleeping healthy? My significant other seems to need very little sleep, not to be a drag point. He gets up early and goes to bed late, nightly to known obvious consequences.
Well, that's a good question. Obviously, we have that bell curve, right, Deborah? So, you know, there are outliers there. Most of us fall in the middle of that bell curve. But if someone actually is satisfied with sleep and it's whatever amount that they have is not interfering with their functioning and feels refreshed, and that might be some kind of outlier, right? And there are people who actually need 4 or 5 hours and they function perfectly all right. And, you know, we don't need to squeeze them in, you know, one or another box to say you're supposed to be this or that. So if it's working for that person, maybe that's what it's needed. And if they try to sleep longer and they are not able and they feel fully refreshed, probably that's their chronotype, some kind of merge of both. Obviously, that's a good point to mention, because we cannot just be in 2 categories. The chronotype actually goes from early morning bird extreme to late night owl extreme, and then there are variations, and we are in the middle of that bell curve. That's a good point. Thank you.
Michelle Hicks asks, might you talk to a person who is resistant to using a non-medication intervention? That is, how might you sell trying CBT-I to a patient?
Well, Michelle, I would say, you know, try to show some studies. Obviously, people, you know, resist to someone's opinion, but trying to say what the studies show, that's what the benefits of the sleep, and maybe even trying something from the person's history to see and question, and using obviously motivational interviewing, right? That just tells me almost like anything else, someone with addictions that is not ready to change. We start with that pre-contemplation stage and trying to engage them in a conversation and find those discrepancies where they're saying like, oh, I don't need this, or this is not going to work, but then pointing at research studies and finding that discrepancy in their routines and life where actually is not consistent with what they are saying. So that would be probably the starting point. Thank you, Michelle.
I have another anonymous question. I'm a bit confused about the idea of sleep restriction. Can you explain that again with concrete number example? Also, any thoughts about electronic devices in the bedroom affect quality of sleep? Question of 4G and 5G EMF.
So sleep restriction, thank you for that question to the anonymous person. Sleep restriction is referring to the concept where a particular example would be if I am able to sleep only 5 hours, right? And I'm distressed that I slept only 5 hours and obviously wanting more sleep, and I'm anxious that I'm not going to be able to perform well, and I'm trying to still lay in bed and say I'm going to at least rest, or I'm going to be at least in bed, and hopefully somehow that's going to help me. The idea of sleep restriction is to get that person out of bed, because staying in bed and not being asleep is not helping to boost our sleep drive. Sleep drive can be boosted only when we are out of bed and engage in activities and we are active. So although for that particular night, I might just have 5 hours to sleep and my performance might be not optimal during that day, but if I get out of bed after 5 hours, I will not engage in my attempts to produce somehow sleep. Otherwise, trying to help my sleep drive, my sleep is going to be better next night if I get out of that bed. Staying in bed for more time than I actually slept might just mess up the whole sleep system in my body, where I will start then associating bed with wakefulness and worry and deflate my sleep drive. So that would be an example. And in terms of the electronic devices, yes, they are advisable to be that people would discontinue using them after bed or at least 1 hour before sleep, that they would reduce exposure of light. In terms of particular devices and how they square if they have any kind of light protective shields or whatever they are, I cannot comment about that. Probably would need to research the manufacturer, but most of these devices are still exposing us to blue light that is interfering with melatonin production and not good sleep hygiene.
Thank you. Melissa Menon says, are there resources you direct clients to read or utilize for CBT-I interventions, i.e. handouts, websites, apps?
Yes, actually there are resources, and I think, Helena, I probably produced more, gave more resources in my previous presentation. There is a CBT-I app that's a wonderful free app. And, I'm making a note to myself, CBT-I app, that I will include a link in the reference section in my slides where you can go and review CBT-I app. And that is a huge resource for the clients. And obviously there is quite a bit of literature for people research studies online. One of the books that I recommend to people, like self-help workbook, is actually, I have it right here near me and I can show. It's Quiet Your Mind and Get to Sleep, and that can be very helpful to the clients. And know if you can see that. That's by Carney and Manbel and other people. So if people can see it, feel free to review that resource, and I think your clients and you would enjoy finding many suggestions, suggestions for activities, and also examples of schedules, sleep schedules that would help you as a clinician to assess the client and determine what are the best interventions.
So Vila, when you send the email with the newest presentation, you could maybe have that in the email, the name of that, the title of that book and the author for us?
Okay, that's a good suggestion. Yeah, I'm making a note for myself. Yeah.
Thank you. I need to go back. I missed a question. Are there longevity studies on people working the night shift? That comes from Megan Mann.
I think I already talked about that
answered
question.
that one? Okay.
Dr. Jacko.
Okay. Another anonymous.
I hope I answered. I hope that's not a repetitive. Maybe I didn't answer it completely. I apologize if I misunderstood something.
Another from anonymous. For a patient who comes to treatment already using pharmaceutical resources to help sleep, for example, Ambien, Trazodone, as athletics, would you recommend discussing with the patient and treating physician the possibility of using a drug holiday to attempt CBT-I?
Yes, I would definitely work with a prescribing physician and use that type of suggestion. And many people might be uneasy about that because they already so much rely on that prescription medication. But that would be one of the ways to approach the situation. Yeah, I appreciate the question.
Okay, thank you. Suzanne, I apologize with the last name, Preeb. I'd like to hear more about how naps or resting outside of the bedroom can affect sleep.
I think maybe I already mentioned that a little bit in the previous questions, but naps pretty much are considered to deflate our sleep drive. They take away from quality and ability to produce our sleep on time, and then quality of sleep. So it would be also important if that's a client, and is that a client who is anxious and then very protective of those naps, what is that? Like that's an opportunity would be then to look to cognitive reappraisal interventions. What are the beliefs about those naps, and having more context about why the naps are needed, because the naps based on CBT-I theory that stands behind it interfere with strengthening and boosting our sleep drive. So we would need to look and understand what's happening, why this person needs those naps, or maybe just beliefs about naps that this person needs. So that probably should be addressed there. I hope that's what was asked about.
All right, we have Anonymous making a comment. Sleep masks and weighted blankets have been helpful to many folks. I heard conversation about sleep masks, but have you talked anything about weighted blankets?
Yeah, I haven't talked about that, but yeah, obviously I saw that being promoted, and that can fall in the sleep hygiene type of thing, where we are trying people to help people to establish whatever comfortable place to sleep, soft mattress, or curtains that are not permeable of light. So some people who especially are restless and have anxiety, and even some people on the spectrum, I was hearing that they use with weighted blankets. And sometimes can be that's the only intervention from the perspective of the sleep hygiene that can help. So there's nothing that I would recommend everyone to use that, but if nothing is working, and maybe that's something that can be tried, and that person, because these sleep hygiene, many in many ways, the same as relaxation interventions, can have personal preferences and kind of personal match, or what works for that person best. So that would need to be determined. But thank you for bringing that comment. Yes, that weighted blankets, some people like them and they are helpful to them.
So Michelle Hicks asks, in the cases there are other potential issues that are not insomnia directly, for instance, the loss of her relationships seems to be contributing, how might that be addressed?
So obviously, if there is depression, anxiety, whatever other things involved, we would need to treat that. But from the perspective that insomnia, if in that particular context, Michelle, insomnia is a component, the research studies are showing that addressing just insomnia based on these components of CBT-I sometimes that can take care of other symptoms, right, associated with other symptoms. And especially where loss is involved, obviously need to process loss, need to grieve loss. So anxiety associated to that need to be treated, and depending what kind of theoretical orientation that we use that is compatible with that person, that we would use to treat that component as well. And there might take some time to grieve and go through the stages of that loss, and at the same time implement all the components of CBT-I. I hope that would address the issue through time.
All right, our next one is another anonymous. Andrew Wales' news fast idea seems hard to implement in these times, but worthy try. I recommend to clients that they stop consuming news later in the day.
Oh my goodness, this is such a good comment. I don't know. Actually, we didn't get to the slides, and as I see, we'll not be able to get to them because we are camping with the questions right now. But one of the risk factors that increases anxiety and PTSD symptoms in people, and depression, the research studies are showing at this time, people who are watching news about coronavirus and listening news for more than 3 hours, actually that's a huge risk factor for insomnia and depression and anxiety and PTSD. So that is a good comment, appreciate that.
All right.
So reducing intake of negative news that are not related particularly to your functioning and your work, and that is a good sleep hygiene and a good kind of sleep hygiene that plays into sleep during the day and during the nighttime, reducing negative news that are then playing into negative messages in our minds, and increasing arousal, then that is kind of contraindicated to good sleep.
All right, our Annie Torres asked, how about how long should CBT-I be attempted as an intervention before you decide to try something else, such as pharmaceutical intervention, maybe 2 or 3 months?
Well, Annie, thank you for the question. Actually, CBT-I is supposed to work relatively fast, and some research studies showing that as few as 4 to 8 interventions, that would mean 4 to 8 therapy sessions or hours, people should be encouraged and see results, and that might inspire them to stick to those components. So I would think obviously 1-2 months probably, and it depends how severe the problem is. So based on the client. So to some people can just educating, and they go and implement, and they experience. I have a client who after one session was so inspired that it was working, and he was more capitalizing on the cognitive reappraisal because anxious thoughts were keeping him aroused and awakened. So it depends on the client, but it should work relatively fast, but unless someone has comorbidities, that can take more time, obviously.
All right.
Thank you.
Yeah. Daniel Jupiter Keegan writes, granted, straight sleep might be better than ANP than naps, but sometimes one stays up later due to work or social, and sometimes a nap seems better than sluggish half a day. Seems better to take a short nap than perhaps a 40-minute nap. Not too late in the day.
Well, Daniel, I am against naps, but if that works, if naps, obviously, I don't want to be rigid. If actually naps works and you think that you have good night's sleep and your client has good night's sleep, even with naps involved, why not taking the naps? Don't want to be legalistic based on CBT-I, these rigid things. We need to sometimes introduce some flexibility if you feel more refreshed. And that also then my question is, might be there other sleep disorders involved, like maybe sleep apnea, maybe something else, like why that nap is needed. And naturally we have those dips in our energy, like from 1 to 3 during the day, where we feel sleepy, and maybe maybe some other things can be done to boost that energy, healthy things. But if nap what it takes, and a brief nap, and it's not interfering with the sleep quality and longevity during the night, why not then? I pedaling back with my suggestion about naps a little bit, disconnecting from what CBT-I requires, but should we not do that with all kinds of interventions? It depends what is helpful to people.
All right, we have 4 more questions. Kate Wilamska of the Juniper Center writes, nutritional approach is worth looking into. Intermittent fasting kickstarts production of human growth hormone and doubles the production of melatonin, both aid sleep. Knowing how long the intermittent fast should last is the key, though.
Awesome comment. Yeah. How we should probably look into more comprehensive things, not just one component of things, because that's our body. It works in tandem with all kinds of parts. So obviously nutrition, and I saw some research studies like you were saying about intermittent fasting. I care about these particular details where they would determine how long intermittent fasting should last, and that's probably is going to be very difficult for the research to determine that for all of us. But those are good adjuncts to look at, and even various kinds of foods, and what even saffron. I saw on the American Association of Sleep Medicine webpage some studies about various foods and how saffron is contributing to maybe better, healthier sleep. So yeah, those comments are great. We need to look at more and more things, and but how to implement for any particular person, that might be a challenge. We are getting more and more findings from the research studies, but then getting overwhelmed with all of them and thinking like, okay, how to adapt that to this particular client? That's a good question.
Fran Weinstock writes, can you please comment on the benefits of pillows that play music in sound machines? Thank you.
Sounds like fun pillows. Thank you so much, Fran, for that question. I'm wondering, okay, so those pillows, are they playing like a calming? I would assume that they are playing some kind of soothing music. And if that soothing music is helpful to relax to the person, that's a good thing. If actually this person starts relying on that pillow to make them fall asleep, again, that might cause problems in the future, where this person may be traveling and going somewhere, or the pillow, the mechanism of inserted in the pillow that plays the music breaks or something, and here the body, the mind of the person is conditioned to that music and that pillow, so that might start causing problems. So again, that the pillow would not become a crutch and would not take over natural body's ability to produce sleep. And CBT-I is geared toward empowering our natural ability, our sleep drive, to rely on itself and trusting our sleep drive, and not that pillow. But obviously that pillow has some potential, I would think, if it's if person is enjoying that music and that's relaxing, but not thinking, oh, this pillow is going to make me fall asleep and I need this pillow for that. Thank you for that question.
All right, we have 3 more questions. The next is from Kathleen Shea. Dr. Kathleen Shea, the health triad includes nutrition, movement, and sleep. Please comment on contradicted foods of obtaining quality sleep, and please comment on foods that promote sleep quality.
Yeah, that's a good question. Probably maybe a nutritionist would answer that with more quality than that question than I can do, but excuse me. But obviously, like we mentioned before, like saffron and some spices, and like we know that we become somewhat sleepy after eating turkey, and the chemical that is involved there are tryptophan, right? If I'm,
yeah, tryptophan.
Yeah, tryptophan. So there are obviously foods, and being aware what foods, how they affect us is very good. And in terms of drinks like caffeine, right, how it's interfering with adenosine receptors, and that goes with sleep hygiene and being able to establish foods and avoid certain foods that are digestible, metabolized. Like, for example, alcohol, if we drink it close to the night, it takes a lot of energy of our body to metabolize it. So obviously that would impair the sleep. So that's why either eating should be at least 2-3 hours before we go to sleep, and paying attention to particular foods that may promote or interfere with the sleep, like energizing drinks of some kind, obviously not consuming close to bedtime. And the healthier diet it is, the better promotes sleep.
All right, thank you.
Thank you so much,
Thank you.
Dr. Shen.
We have 2 more questions. Both come from Annette Lacey. Do people who engage in shift work live shorter lives because of their sleep deprivation?
Oh my goodness, and that's such a good question. I think I had that in my first version of the slides, that I started at 70 of them and then had to cut, because obviously we would need to sit the whole day to address all those topics. But yes, research studies are showing that sleep deprivation is associated with shorter longevity, mortality, higher mortality rates. And sleep deprivation is also associated with suicidal ideations. And I only wonder how much people actually commit suicide. And we do not have that research study that would show how much sleep deprivation might be associated to that type of mortality. But that's a very good comment. That's a huge risk factor even in the longevity of life.
All right, her second set of question was, are you aware of any effects of TBI on sleep problems and dreaming?
I should say that no, at the moment I cannot think about any research study about that, but I should look into that. That's a very good question. I appreciate that question, Annette.
All right, well, that completes, oops, we have one more question. Megan Mann comments, lobster, high in tryptophan, yum, salmon salmon and foods high in B6 responsible for producing melatonin.
Awesome. Thank you so much for that comment.
Thanks, Megan. All right, so thank you everybody for coming, and for all of those, all 32 of you who are still here. Anybody who is doing the CEUs, again, you will get them Monday latest. It'll be in your inbox. Everybody will be getting the email that Dr. Ball will be sending to me with the presentation, also with the name of the book and any other pieces of information she thinks will be helpful for you guys. I'll just forward that on to her, onto you all. That will also lend you her contact information in case you wanted to reach back to her for any other fine-tuning questions or for referral of information with your clients. We hope to see you next month. I thought we were going to be off, but it sounds like we are going to be having a presentation. Please keep your eyes out for the bulletins we send out and the listservs. Dr. Ball, thank you so very much. Yet another fantastic presentation. I hope everybody has taken with them now a whole lot of information that they'll be able to use maybe in their personal life, but definitely in your professional lives.
I so very much thank you for everyone to being here with me, and I hope you are inspired to attend more to sleep and to be more aware of all that is involved with sleep and insomnia. And thank you so much, Aline, for all your help to facilitate this presentation. Everything is very appreciated.
Absolutely. All right. Well, again, thank you everybody for joining us. And Dr. Ball, as always. Have a great weekend, everybody, and we'll see you next time. Thank you.
Thank you. Bye-bye, everyone.
Bye-bye.